Hi everyone, welcome to Nityal Lab podcast. So we have announced this month is completely on low back pain awareness. So now we'll deep dive on what is the neuroscience of low back pain, and the future episodes will see what are the biopsychosocial aspects involved in treating low back pain. So now prior entering into the neuroscience of low back pain, I would like to give a brief gist of what is low back pain. So low back pain has been defined as any pain between the T12 region at the upper lumbar and towards the S2. So any region or any pain between these particular regions is called as a lumbar pain, or it is called as a low back pain. So now coming to the main categories, when we see in terms of low back pain, it has been classified into multiple categories. So if you say it is going to be in terms of lumbar pain with mobility deficits, or few will say it is in terms of lumbar pain with radiculopathy, and there is another category called as the low back pain, which is non-specific in nature. Now, when we are trying to identify or treat this particular low back pain, there are two major categories which we generally follow as a physical therapist. The first category is on how the pain is advancing. Whether your patients are getting recovered within the initial 2 weeks, then the course is called as a normal course. If the 2 weeks the pain has become very unbearable and the physical activity is becoming a very low day by day, then it is called as an abnormal pain categories. In a normal as well as an abnormal course, we are going to identify whether the patient is getting better or patient's condition is deteriorating. Say in terms of mobility deficits, an individual with low back pain, when he is coming to OPD or when we are trying to treat them, the initial stiffness of low back pain is going to subside gradually and he is going to perform all the ADLs normally, means the activities of daily living. But in case of the abnormal categories or abnormal patterns, we tend to identify that the condition is not getting better, it is going to become worse gradually day by day. So as a physios, we use multiple modalities, mobilization techniques, manual therapy, and multiple areas like your mobilization or manipulation, taping, cupping. All these particular sorts of therapies will be given to individuals with low back pain to make their condition better and to make the pain ease off. Along with this, there is going to be pharmacology that's coming from the medical side. So pharmacology, surgical management are everything which we know. Now coming to the neuroscience aspects. So what was the important things that we need to see? How the brain will involve in chronic pain. For example, low back pain has different stages. There is acute, there is subacute, and there is chronic. But the recent IASP definition says that there is only two categories. One is acute pain, other one is chronic pain. In terms of these particular patterns, the main important aspects is the pathways. So low back and the lumbar region as well as the spinal cord and brain, these are all connected. Now coming to the main important aspects of what is pain. Pain is an unpleasant emotional, or it is going to be in sort of a perception that we usually get when there is either a tissue damage and when there is no tissue damage. The IASP definition of 2020 has been revised as it is more of an emotional component as well as an experience. So usually when we see in terms of neuroscience, pain is a learned experience. For a simple analogy, if you see a small child or a toddler, they doesn't understand the influence, whether there is any hot object or anything. They just go and touch the object. Gradually, what brain learns here is whenever you tend to touch something hot, or if there is something super duper cold, you are going to end up into an injury. This is how the brain learns. This is called as a learning experience. Likewise, the brain has the capability of learning about pain as well as unlearning about pain. For example, after a few days, we forget about the particular pain and the incident, but whenever we think of the incident, the thought of the injury, it is going to create the experience again. We may not get injured again, but we relive the experience. That's the main important aspect and the main important function of the brain. It makes you relive the experience again and again, even though when there is no actual injury happening at that particular point of time. Now let's see how brain perceives as well as how pain signals travel. So when the pain begins, it is because of a tissue injury or a tissue damage. When you snub an object or when you get injured there is going to be a pain signaling from the site of injury by the nociceptors, and this will travel to the spinal cord to the brain, and from the brain it will take an impulse coming down and whether to take an action on that or whether to leave it. For example, when somebody pinches you, you just rub, you don't hit back. There is no bigger emotional response in those particular categories. But when you are very irritated or when something is bothering you, if someone does the same thing, you react in a different way. So the brain decides on how you have to react, how much you have to react, and how does the reaction come up is on the brain's category. So coming to the neuroscience of this chronic pain, there are multiple centers of brain which is going to work on. Now let's see what are the main functions of dorsolateral prefrontal cortex. It does something called as an executive functions. It is important in planning, it is important in inhibition, it gives you something called as task switching. When you perform one task to another task, this is the area which is going to work on. Next thing, it creates something called as an emotional regulation. So we have discussed prior. Emotional regulation is the main important area of this particular region of brain. It regulates your emotions in terms of reaction or in terms of whether you have to subside the activity or whether you are going to go for an explosive bouts. It creates something called as a progressive as well as cognitive processing. The dorsolateral prefrontal cortex is activated during pain there, and the activation is abnormal in people with chronic pain. So that's a main important which area which will trigger all these particular parameters. The next part of the brain is anterior cingulate cortex. So it helps in problem solving, social behavior, cognitive aspects, decision making. During chronic pain, most of the individuals will have dysfunction in identifying or dysfunction in doing something called as a problem solving approach. Their cognitive issues is going to become very high because of this pain. They could not do in terms of decision making. So decision making skill is going to be poorly affected and cognition is going to be poorly affected in individuals with chronic pain. So coming to the next important area, periaqueductal gray, so PAG. So usually when we see in terms of electrical modalities or when we are trying to treat individuals with pain using the TENS or IFT, so PAG is the area which is going to work on and the neurotransmitters from the area is going to come to the lamina 2 and inhibit the pain. But in individuals with chronic pain, periaqueductal gray is also very important because it changes something called as a cardiovascular response. It has an altered activity in giving you cognition as well as pain modulation is going to be affected here. And the other important function of this is sleep wake cycle. Now, individuals who have chronic pain will have severe pain during night, they couldn't sleep here. So, this creates a sleep wake cycle, ultimately not letting the individual sleep. The whole sleep cycle is going to disturb, and the circadian rhythm is going to be disturbed because of this particular chronic pain. Another important factor which we see here is because of this chronic pain and ongoing pain for long duration, so usually more than 6 months or more than 6 months to 1 year, it is going to hamper nucleus accumbens. So nucleus accumbens is one particular area which is going to give you the emotional response. And next to that, there is adjacent areas of respiratory centers also. So individuals who have this chronic pain will have dysregulation breathing as well as they are going to have an outburst of emotional response because of the higher triggering of nucleus accumbens. What happens when the nervous system is going to get continuous stimulation? It is going to create something called as pain cycle. So usually when there is any pain, there should be a subsidization of pain after some time. This is your normal pain response. But the nervous system here is going to become high and it is going to become hyperactive, ultimately leading into a process called as central sensitization or peripheral sensitization. When the same site of the injury, for example, individuals with fracture of distal radius is going to get something called as complex regional pain syndrome. So here what happens is the area of insult might be very small. It could be only in the distal radius fracture or it could be in the low back region. But that area is going to become hypersensitive because of these continuous inflammatory pooling or continuous hypersensitivity of the nervous system, leading into the peripheral sensitization. When this peripheral sensitization is going to go from the periphery to central in the spinal cord and from spinal cord to the brain there, it creates something called as a central sensitization mechanism. To simplify this, imagine that you had an injury and after some time the pain will subside without giving medication or with medication. So once the pain subsides, we are not bothered with the injury there. In some individuals, there is going to be a continuous impulses traveling from the nervous system to spinal cord, from spinal cord to the brain there. In those individuals, they'll have a continuous stimuli that is going to stimulate the nervous system. So even the injury subsides, the brain thinks that there is an ongoing inflammatory process or there is an ongoing injury there, and the injury is not healed completely. So what it does is it creates a furthermore anti-inflammatory response in the area, making that area hypersensitive. Ultimately, this leads into a complete process of central sensitization and magnification. Now, if an individual has central sensitization, is it the ultimate thing or we can't do anything for the individual? Now there is a beautiful concept called as neuroplasticity. Neuroplasticity is a way of brain to learn as well as to unlearn about pain. For example, when there is a higher pain response or higher pain threshold, the individuals usually have a magnified brain saying that this is the area of injury. Means the brain is learning more about the pain. At the same time, when we can treat the individual, there is a process called as unlearning about the pain. Now, the brain which is sensitive about the particular pain there will gradually think that there is no pain and it is going to subside. So there is a beautiful concept called as graded motor imagery. So when we treat the individuals with low back pain, either in terms of the sensoromotor training aspect or in terms of the graded exposure concept. So what we generally use is we teach the brain or we make the individual perform the activity showing him that it is not painful. Till then, what has been taught means what the magnification of the brain sees, there is a pain in the activity. But when we go in terms of graded motor imagery, making the individual think and making the individual give something called as a mental feedback. In these areas, in this particular practice, they will unlearn about pain because they think it is not harmful and they perform the activity. It gives a continuous impulses to the brain saying this is not painful. When the brain perceives the area is not painful and it is not a threat in doing the activity, it subsides its activity and it goes to the normal stage. This is the neuroplasticity which we generally use. Now, what are the other concepts which can be used to improve neural sensitivity as well as the neuroplasticity? So, it is on mindfulness, mind body enhancement as well as mindful therapy. So, when we do activity in terms of a conscious state, the brain perceives the activity as non threat. So, gradually it will work on those particular movements, it will reduce the particular pain and increase and enhance the amount of activity which we generally do. The next activity which we do is nothing but relaxation techniques. So I told you nucleus accumbens. When you try to trigger that particular center, the adjacent centers are the inspiratory centers. If you can go with breathing exercises or if you can go with relaxation exercises, the area is going to gradually work on and it is going to subside the amount of emotional response the individual has. So in this particular way, we can gradually reduce the brain's response in doing the activity. So before we wrap up, we have seen what is low back pain and what are the categories of low back pain, and we have seen what is chronic pain and what will happen in chronic pain, and what are the brain responses which we see in terms of the chronic pain. And then we have identified what is neuroplasticity, the concepts of neuroplasticity, and what will happen in terms of the pain cycle as well as the pain brain interaction. So in the next podcast, we'll see what are the different types of low back pain methods we use and what is the neuroscience behind each and every method. If you like this podcast, give a like and hit subscribe. We'll see you in the next episode. The next episode is on low back pain interactions as well as what are the therapies involved in low back pain. See you in the next podcast.